The John McMennell Award is an award that we also have the honor to award to do with awards, to award awards, to award to one of our members. The purpose of the award is to acknowledge and honor individuals whose contributions to the advancement of orthopedic manual physical therapist's role in management of musculoskeletal disorders like those of John McMennell have been of exceptional value. I'd like to ask Michael O'Neill to come up and introduce this year's recipient.
Well, it's my distinct honor to present Chris Showalter as the this year's Manel Award winner. I've known Chris for 8 or 10 years or so. We've worked a lot together as chair of exam committee. I've always been able to count on Chris for his expertise and policy making and review. So I think Chris has done a great job working with us on the exam committee. He also holds another hat in the academy. Chris has been the chair of the International Affairs Committee for 8 years, and he's been the rep to IFOMPT for 8 years. I've talked to some of our past presidents and past president of IFOMPT to get some ideas on Chris's contributions to the academy. And I think Ken said it best when he said Ken went to Ken Olson, who is director of IFOMPT at this point. Ken went to IFOMPT. The respect that they've had for the U.S. has been a lot of Chris's work in the academy and building up that respect for the U.S. So I'm privileged to have Chris as a friend and a colleague, and I think he's extremely deserving of this award. Chris?
Tim, IFOMPT's not hard, it's just about drinking beer with the Dutch. You know that already. Thank you, Michael. Mr. President, Executive Committee, members of the Academy. It's a tremendous honor to accept this award. I can't honestly stand here before you and take sole credit for this award. It's really just a case of good fortune. To quote William Shakespeare from the 12th Night, "Be not afraid of greatness. Some men are born great, some achieve greatness, some have greatness thrust upon them." My friends, I am not great. I'm just very, very fortunate. Fortunate first and foremost that my wonderful wife, Joanne, fully supports my varied professional interests and the resultant need for travel and time away from family. Without her support, my endeavors would not be possible. Fortunate to understand that it's a wise man to thank his wife at the beginning of an acceptance speech to ensure he doesn't forget to do so. Fortunate that I've had the pleasure to serve the Academy in various ways on different committees. To be frank, I've never really viewed my work within the Academy as any kind of burden. Rather, I've always seen it as a chance to serve our profession and spend some interesting time with colleagues who have subsequently become very good friends. We spent our committee time in interesting, sometimes heated, debate, troubleshooting a problem, planning a process, or working towards a common goal. All the time interspersed with generous doses of laughter, coffee, and the odd beer or two. After our formal meetings, of course. Fortunate to have professional colleagues and friends in Maitland seminars who give freely of their expertise and their strong and usually correct opinions about the teaching of Jeff Maitland's principles. Colleagues who remind me of the important charge that I've been given. Fortunate to be part of a profession that measures success in terms of patient well-being and capabilities rather than profit and market share. Pain reduction, improved function, patient abilities. These are the hallmarks of our success as clinicians. Fortunate to be practicing manual therapy in a time when the efficacy of our interventions is increasingly supported by strong scientific evidence. Fortunate indeed to have been mentored by some wonderful clinicians. Sir Isaac Newton said, "If I have seen a little further, it's by standing on the shoulders of giants." I don't know how far I've seen or will see, but I can tell you that it would not have been possible without the mentorship, friendship, and guidance of three giants who shaped my professional life. The first giant is Chris Conway. Chris is a private practitioner in Australia and studied with Jeff Maitland during the graduate diploma in manipulation, as was then called in 1979. Chris is a superb clinician with wonderful hands. As a young physiotherapy student in Melbourne, I knew that it was whispered that if you did a clinical placement with Chris in his small rural hospital, he would teach you the secret knowledge. No, not Harry Potter spells or the underlying meaning of Freemasonry. He would instruct you in the art of manipulation and mobilization, based upon clinical assessment and clinical reasoning. Safety considerations were paramount with Chris, and his instruction was hard, if not harsh. He would accept nothing short of perfection for the safe application of highly detailed and specific movements. I was constantly justifying how and why I performed a certain technique and then evaluating its effectiveness. I was hooked. Chris put my feet firmly on the path of orthopedic manual therapy. We became friends. He helped me advance in my studies, and Chris and I eventually went into practice together. Thank you, Chris. You're a good mate. The second giant in my professional life is Bob Sprague. Bob was a fellow student of Maitland with Chris in 1979, and upon his return to the US, took up a position as chair of physical therapy department at Ithaca College. Eventually became a fellow of the academy. Bob steadfastly emphasized the importance of clinical reasoning and insisted upon its inclusion as a core component in the Ithaca PT curriculum. Bob founded a Maitland-based teaching company called Cayuga Professional Education Associates in 1985, and thus became instrumental in ensuring that Jeff Maitland's concepts were widely taught in the United States. Chris Conway introduced me to Bob at some point, and Bob asked me to help him out in an upcoming course. Then a few more courses, and gradually over time doled out a portion of the courses to teach under his watchful eye. Eventually, after a number of courses taught together in his typical unpretentious fashion, Bob said, "Do you think you'd like to teach some of these courses for me?" Some years later, I went to Bob with a shopping list of things that I thought could be clarified, incorporated, and added to the courses. Bob listened quietly, and then, as was his easygoing way, he just said, "Why don't you just take over the company from me and take care of those things?" When I asked him why he chose me to take on this huge responsibility from him, he said it was because I was passionate about concepts, a passable instructor, and that he knew I would keep true to Jeff Maitland's original teachings. In short, I would not bugger it up, as Bob said in the Australian vernacular. Sadly, Bob passed away in April this year after a short but tough bout with brain cancer. He had a tremendous impact upon our profession and upon those who had the very good fortune to know him and called him friend. He is deeply missed and fondly remembered. Thank you, Bob. We won't let you down. The third and final giant that I would like to acknowledge is Jeff Maitland. Many of you know Jeff and his teachings. You probably know that he studied with Syriacs, as did others. You know that Jeff helped co-found IFOMPT along with Stanley Harris, Greg Grieve, Freddie Carlton-Bourne, all in the cafeteria of a London hospital. You probably know that Jeff is steadfast in his belief that clinical assessment takes precedence over theoretical constructs. That's the Jeff you know. I would like to share a few things with you about Jeff Maitland that perhaps you do not know. Jeff was a pilot of a Lancaster bomber for the Royal Australian Air Force during World War II and flew many dangerous missions over Germany. After the war, he studied physiotherapy in Australia and eventually founded the world's first 3-month certificate course in manipulative therapy in 1965 in Adelaide, South Australia. Jeff continuously studied, read voraciously, and during his professional career, spent a dedicated half-day each week in the medical libraries studying the works of all and any professions dealing with musculoskeletal disorders. Jeff was awarded the MBE, or Member of the British Empire, in 1981 for his service to the physiotherapy profession. Jeff was and is a stickler for detail. From his method of accurate and unbiased questioning of the patient in the subjective examination, to the importance of highly detailed reporting of clinical findings, to his adamant belief that irritability is a key concept in the assessment and management of patients. When you write a speech, you have to throw in an anecdote about important people, and the thing that really struck me about Jeff, besides his stickler for doing it right the first time, was a memory that when Jeff once gave a 1-hour lecture that within minutes appeared to be a rather random stream of consciousness. So we students foolishly stopped taking notes and just sat there listening as he spoke of these seemingly unrelated concepts, thoughts, and ideas. With 5 minutes to go in a 1-hour lecture, he tied all of those thoughts together into a coherent, well-constructed, and inescapable conclusion. I sheepishly asked the student next to me if he wrote all that down. Thankfully, he did, and he gave me a copy. I never made that mistake again. Jeff Maitland, quite simply a clinical genius, as Chad Cook writes in his textbook dedication to Jeff, a sentiment that I wholeheartedly share. You may be interested in the rest of this. I spoke with Jeff recently regarding numerous scientific studies supporting our manual therapy intervention. And while he said he was quite pleased with the progress of research, he reminded me of his core tenet that clinical reasoning is critically important. Well said, Jeff. As you know, SACIT defined evidence-based practice as the integration of 3 different components: individual clinical expertise, best available external evidence, and the patient's values and expectations, and that each of these 3 is equally weighted. SACIT further reminds us, and this is a direct quote, clinical skills and judgment are vital for determining whether the evidence or guideline applies to the individual patient at all, and if so, how. So in conclusion, we all enjoy the good fortune of being ably represented by our Academy, the Executive Committee, and our many, many committees of volunteers. As we practice manual therapy in a time of increasing evidence to justify our interventions, let's remember that clinical reasoning is a key factor in determining how the available research relates to that specific patient in front of us on Monday morning. Embrace the research and validate your actions with clinical reasoning. Remember the slide this morning about the British Medical Journal article that refuted the possible value of parachutes? Have a remember of that. Thank you for taking it, to the giants past and present, thank you for taking up the standard left to you by your predecessors, who have generously passed on your knowledge, your skills, and your passion by teaching and mentoring so many of us. To the fortunate ones, we too have a responsibility. Mentor someone and find someone to mentor you, join a committee, get involved in research, serve and contribute to our academy and our profession. In short, let us all continue to strive to achieve greatness. We are all fortunate indeed. Thank you again for the honour of this award.